Reverend Duvall,
Here.
Ms. Taylor. I know she's here. Ms. Taylor,
Here.
Dr. Garza. She's here. Ms. Lee. No, Ms. Lee. Dr. McBride.
Present.
And then Spring Schmidt said she would not be here, so.
Yeah.
Okay, so we have a quorum.
All right. Thank you, Penny. First, I'd like to move for the adoption of the December 18th, 2020 meeting minutes. Is there a
So
second?
moved. Second.
Thank you.
Who seconded?
Tim McBride, second. So, is there any discussion on the motion? Hearing none, I'll call for a vote.
Mr. Schmidt?
Aye.
Reverend Duvall? Reverend Duvall?
Aye.
Ms. Taylor?
Aye.
Reverend Duvall?
Aye.
Dr. Garza?
Aye.
Dr. McBride?
Aye.
Did Dr. Garza answer?
Yes, he did. I think his internet's going in and out.
Gotcha. And Reverend Duvall?
Yes. Can you hear me, Penny?
Yes, now I can. Thank you. Okay.
All right. By a unanimous vote, we appear to have approved the December meeting minutes. Thank you all for that. So the next item on the agenda is a discussion of an RFP for a study of the jail and a prescription of best practices for the jail moving forward. This is something that we've discussed for months. We've talked about the need to kind of do a deep dive into how we, kind of how we got here, what some of the challenges have been along the way, where we need to go, and how we can get there. We, because of the, I think, dysfunction of parts of the jail over the last several years, and because there doesn't seem to be a local kind of model institution, I think all of us have felt like it would be helpful to have an entity come in, probably a national organization, that can come in, again, take a deep dive into our facility, and then offer some, kind of an analysis of best practices around the country in operating a facility that is as humane and effective and safe, and I think does everything possible to reduce the likelihood that people will ever return to the justice system. So I would like to just open it up to discussion from the board to see if others have thoughts. Again, this has been kind of a running discussion, but I'd like us today to go on the record once again, because I don't want to let this slide. I know that we, in our initial conversations about this around 6 months ago, the county did began embarking on kind of a smaller scale study that was more narrowly focused, primarily on some personnel challenges. But I'd like to do something broader, something that really gives us a beacon, kind of a guidepost that we can shoot for, and does a little bit, goes deeper and wider as well. So I'd like to hear from members of the board to see if people have thoughts. But I would like us ultimately today to go on the record, again, reinforcing a recommendation that the county open up an begin an RFP process to do this. Okay, I'll stop. So Alex says that the connection seems to be going in and out for him, so that may account for the lack of response to my question. Can you raise your hand if you can hear me?
So Jeff, I could hear you, just it would delay and sort of go in and out. So I don't know if that was my internet or if it was from the meeting. So I was going to go ahead and stop my video just to share, just to save bandwidth. But I don't know if it was just my connection or if everybody had the same issue.
Okay. Is there any?
Can you hear me, Jeff?
I can hear you just fine, Alex.
Okay.
So
okay.
Since I know I can hear you, do you have any thoughts on on a resolution?
Can you? I apologize, but could you just repeat what you said about the RFP?
Sure. I said that it's been a running discussion here on the board for several months now. And I think there was a broad consensus on the board that while some type of interim look into primarily personnel issues, while that was probably necessary on a short-term basis, that it's the broad consensus of the board that we'd like to see an outside review into some of the deeper cultural issues that have landed us here, and then has the also the ability to look at best practices around the country for operating the most humane and effective, jails in the country. And when I say effective, I mean reducing the likelihood that people who are in here ever come back here. So I'd like to see an entity that has some experience with this sort of thing and is familiar with correctional facilities around the country to come in and do that type of review. We have new leadership, and I think we feel good about the new direction that the jail is going in. But as positively as I think we feel about Director Burris and his leadership, he will be the first to admit that he came out of the probation world, which is different than operating a correctional facility. And I think it would behoove all of us if we were able to have a deeper look at this and also a prescription, again, of best practices nationally to give him a guide of where to go and how to get there. And I think I would like for us to go on the record today and reinforce the need for that, despite any short-term investigation that's been done, that we'd like to see something like that.
Right. Thank you, Jeff. So from your description, to me, this sounds a little bit like a half of a sort of an operations review. So coming to sure practices and all of the other things are where they need to be. And then part of it is more of strategy development as well, because obviously you're not going to change a lot of that stuff overnight. It's going to take a prolonged period of time, and then you have to organize your programs around it as well, and that really takes a strategic plan. which I think is what we've been asking for a while. Like, what is the strategy of the jail? What are we trying to do other than just house inmates, right? So I am completely in favor of that. The concept of an RFP, or how, you know, the county would, I shouldn't say we, how the county would. But I support that move.
Yeah, Jeff?
Great. Yes, Tim. Thank you, Alex.
Yeah, I support this in general as well. And, you know, I think when we passed the resolution we did back around the time Director Burris was appointed, you know, there was a lot of things the directors had to take on. And, you know, I realized, as you mentioned, that there were some personnel issues that had to be handled, and there were some things that that were immediate, that, you know, we can't really necessarily discuss in public forum, but there are a bunch of other things that we asked for to be brought back to our board. And we listed them out. And I think it's important that we hear back on that in a timely basis. So I think we're on record already in saying what those are. And I don't think, you know, I think the spirit of what you're asking for is that there be a timely response on the things that we asked for, and I'm in support of that.
Thank you, Tim. Okay. Is there anyone else
Jeff?
who'd like to discuss this?
Yeah, I'm happy
Yes, Mary?
So I don't think this is a different resolution than the one we passed in August, but I'm glad to hear you bring it up, and I'm in support of it. I just don't want it to sound like it's something new. And so I echo Tim's offerings, because we've already put a lot of work into this scope document. We have a sense of where the areas were that needed a deep dive. And I think events that have happened since then have just, in my mind, cemented that the external independent investigation needs to happen, and there are many other areas that do need to be looked at, systemic issues that need. The other thing we talked about in August and September, I think, was, and I think Alex sent us, some examples, and I had some examples of what an external investigation would look like. Based on the response to our scope document, I don't have hope necessarily that we'll have any input, but I feel obliged to say it anyway, that who does it is almost as important as what is done. And so, there's always a challenge with experienced people that they won't have a new set of eyes. So that would be, while it's certainly possible, I think that's great. I think some of the examples, I think Cuyahoga County and some of the things Alex sent, and some of the information that I sent on to, I think I sent it to Beth Orwick and to some members of the council about these kinds of investigations into other county jails in Missouri and in other states, suggest that really someone needs to come in who is not a consulting firm known by the county, and that it truly is an RFP process that would bring us kind of an unstinting, clear-eyed view of what's going on. And I think the other thing is, Jeff, I appreciate you bringing it up. And I'm glad you are hopeful, but I will wait and see as to whether or not we get any different response from this resolution than we got from the one in August and September. If we could include in the resolution some response, I would appreciate it. And just to remind you all that when Tim and Phil and I met with the county executive, that he did say that our scope document and that the board would have some input into framing what the scope of the RFP would look like. So, and then many things happened in between. So I just want to raise that and remind us all of that promise that going forward, we would be involved in the, perhaps not in the choosing, perhaps not in all the detail, but that we would have some input because of our scope document and because we have been many of us have been the listeners of whistleblowers, that all of that effort doesn't go wasted. So with that, I'm in agreement that we go forward with a resolution, and whatever you propose, Jeff, I'll be happy to hear. It's with all of that, behind it, that I remain skeptical as usual.
Okay, well, Phil, did you have any comments?
No, I pretty much concur with what everyone has already said. So as long as we're saying officially on the record is that we capture the document, the scope document that's already been presented, and to enforce what Mary just said on the end, that there be participation from the advisory board, at least when assembling the RFP. I think that the scope document had 11 points, and that document is thorough enough. So I agree with officially going back on and pushing it forward, but to ensure that there will be, what Mary mentioned, at least some feedback and conversation prior to them, the county approving the RFP.
Oh, Jeff, I'm sorry.
So, go ahead, Mary.
So I forgot to mention, so when I said, some of the events that have happened since we came up with that document and now, I'm also referring to, many of you I hope you saw the Arch City Defenders report this week about deaths in custody, listing that there were 12 deaths in the county jail in the last 10 years. Now, I know we haven't verified this report. We don't know what the facts of it are, but contained in our scope document was a review of the deaths. And I think we put it there because we were still unsure about whether or not we have learned all that we can from any investigation into the deaths in the jail. And I guess with the release of that report, which I think is important to at least mention and to pay attention to, I think it further cements that we should make sure that the deaths in the jail, whether or not they are a part of, we're not talking about detailed things. Whether or not they're talking about cases that are involved with litigation. I think we should be looking at. I was surprised that there were 12. There were 5 in 1 year. We know that, but there were 7 others in the last 10 years, if the report is to be believed. And our city defenders, I have always found to be a very reliable advocacy group. And I just wanted to mention that because it talked about us.
Yeah. Okay. Thank you, Mary. Thank you to all the board members for their feedback. What I would propose to do would be to add to the scope that we laid out, kind of what Alex touched on, which is in addition to reviewing those areas, to look at kind of best practices and a development of strategy for how to improve, so that this is not just obviously not a witch hunt and not just an excavation, but also a guide for our new leadership here in how to do better and become the world-class facility that I think we want it to be. So, and then I would also propose to add, and this goes to what I think you said, Mary, that we are requesting feedback from the county on this request. So, does that make sense? So we are requesting a response on this. Yes, Tim.
You know, and I apologize if this is coming up later in the agenda. Jeff and I agree with everything you just said. And if it's not, if this is coming up later in the agenda, fine. I'd like us to hear an update on our August requests at every meeting until it's completed, our scope document. But if it's not later on our agenda, I'd appreciate an update now from the director or Beth or others about the status of our request from the scope document. Is it appropriate now, or is that coming up later in the agenda?
So, I mean, we can ask. I don't think that Beth will have any update on that request, but I think what we're proposing to resolve is a way to try to get a response by the next meeting, by our next meeting.
So I guess, yes, that's what I think that's appropriate to ask, and I am asking if there is an update right now.
Beth?
Jeff.
Yes, Phil?
Yeah. So help me out. I know we have this request. I know we've done this verbally. In this request that you're suggesting that we're making now and again officially on the record, is there something we're going to send via an email, something in writing? Therefore, we're requesting a response back, because there appears to need to be a paper trail, because there's been a lot of discussion on this with a lot of dates, and then we've seen nothing. So at this point, could this be put in a document?
Yes, I think that's appropriate. It is something that I will send to the county in written form.
Okay, thank you.
Mr. Smith?
So if there is, yes, Beth.
Thank you. I know that your agenda has a closed session noticed up on here. I think that Mr. McBride's question might be more properly addressed at that time due to the nature of the topic.
Okay.
Thank you.
Okay.
And unfortunately, I will not be around for that closed session because I have to leave at 10:45. But
Mr. McBride, I'm happy to speak with you by telephone. Mr. Smith.
okay, thank you.
And since our agenda is not too packed today, Tim, we may be able to get to it before you have to leave. So if there are no other, if there's no other discussion on that, I would like to get a vote on the resolution as stated to request a response from the county regarding to request a response to a recommendation that the county open an RFP for a study of the jail and prescription of strategy going forward to implement best practices nationally at our facility. So that is the motion. Is there a second?
Second.
Phil, I know Phil seconded it.
Okay, Phil second. Okay, so Mr. Smith, who made the motion. Robert Duvall,
Aye.
Ms. Taylor,
Yes.
Dr. Garza,
Aye.
Dr. McBride.
Yes.
Okay, thanks, that's it.
Okay.
And Jeff?
I'm sorry.
When you send the document with the resolution, would you please send it to at least to the executive and to the county council?
Yes, I will, Mary. Okay, why don't we move on to the next agenda item, which is the DJS dashboard. Aaron.
Yep. Yeah, Ray, do you have do you want to share that, or do you want should I share it?
If you can share it, go ahead.
Okay, the share button on my computer is grayed out, so I don't know if
Hold on one sec.
yeah, no worries. Let's see if I can.
All right, try it now.
All right, let me pull it up real quick. I apologize, I have not shared from WebEx before, so I'm looking to see if I can. Does it let you share a web page?
Yeah, it should. I'll come around.
I apologize for this.
Hey, Jeff, while they're getting that together, I just have a question about the data. First, an appreciation. Aaron knows I'm a big fan. I love this, and thank you to the data group who puts this together. But as someone who has lived deep in data for many
Yeah, now
years,
it's letting me do it. I'm so sorry.
my question is, what are we learning from it? How is it?
There we go. Yeah,
how's it changing our practice? And especially since we know that systemic racism exists in all of our organizations, is there any overlay in any of these that will help us see where our weaknesses are?
Mary, was that a question for me?
No, it was for the group.
Okay.
I mean, it really should. It should help us with an appreciation, but it also brings questions about what we could do differently or what we could improve. And I'm just instead of just looking at beautiful charts month after month, which I love, I'm just asking, what are we learning from it? What have we changed as a result of it? Are there any opportunities for looking deeper, especially at the racial disparities in all of these slides? And that's just a question for the group.
If I could jump in real quick before you go, I also want to echo the amazing work you've done, Aaron, and shout out to the teams that have contributed. And I echo what Mary said. And the question is a great one. Now that you've done this work, as I put in the chat, it's a question about how is this data changing practices and process. And it's probably more of a question for Director Burris and, Emily Doucette, standing in for Spring Schmidt, who's not here, about like how to, these data might help change work on the ground. So, Aaron can go forward with this process, but you may want to comment on that later.
Yeah, and I mean, I can chime in on that too. But as for the monthly maintenance of the dashboards, the main dashboard and the supplemental dashboard, which I can pull up in a minute, are in terms of formatting haven't changed this month. I did just want to. There are not a lot of overall things of note that have changed between last month and this month, but I did want to just go over the daily population log, which, you know, and I updated this as of the 20th. So as you can see, it's been bouncing around a little bit in the last 20 days or so. You know, we had a peak over 950 about 2 months ago, and then it dropped to just under 900, and then it's been, you know, bouncing around back between 930 and 950.
Aaron, can I interrupt just real quick on that?
Sure. Yeah.
We had a very busy night last night. We're at 967 as of this morning.
Oh, wow. Yeah. Wow. All right, so I can pull up the supplemental dashboard now. One thing of note that I wanted to show on the supplemental dashboard is that the video visits are now very much in full swing. So as from November, you could see that they were a little bit of a tip at the top of the overall visits, but for this for December, you can see that the video visits make up a sizable chunk of the whole thing. So those are in full swing now. Just wanted to mention that. Otherwise, there are not a lot of ER runs in the last few months. Otherwise, I think in terms of notable findings from the dashboards, from the DJS dashboards, that's probably about it. I know Valerie and I are going to talk about the DPH dashboards after this too. But if you all have any questions about any of these two, this dashboard or the main one, please feel free to ask. All right, Mr. Smith, is there anything else from the board, or should we move on to the DPH dashboards? What do you prefer?
Are there any other questions from the board?
So Director Burris, you said there was an increase to what as of last night?
967.
And that's an increase of how much? I don't want to perseverate on one night, but
Yeah, we were hovering around 950 the last, between 935 and 950 the last few weeks. That's correct, isn't it, Aaron?
Yeah.
So, Doug?
Yes.
I hope I'm not putting you on the spot here, but you talked to me about an initiative that you're working on with judges here to try to address the, you know, continuances that a lot of prosecutors are getting, which is leading to longer stays here and higher headcount. Can you talk about what you're doing in that regard?
Right. In fact, Dr. Beth Hubner and I are meeting at noon on Monday to request a meeting with the bench to discuss ideas about seeing how we can start eliminating, eliminating some of the continuances. We unfortunately have 180 people in the jail that have been here for more than 2 years now. We have one man that's been here over 5 years awaiting trial. Of the 950, well, the 967 people that we have in the jail, they're all there on pretrial status or awaiting a hearing on a probation or parole violation, except for one. We only have one person who's been sentenced to serve a term in the jail. All of the rest are just waiting to get before a judge. But Beth and I are and Miranda as well from the MacArthur Foundation. We're going to meet at noon on Monday and come up with some pinpoint ideas, and then ask to meet with the bench later in the week.
Jeff?
Yes, Tim?
Yeah, I commend you for trying to work on that because, the chart's not up here, but, as we know, we made commendable progress on reducing the census in the jail from, its peak of over 1,000 down to say 800 or so. Thank you. We know why this increase has happened, but in part due to COVID. It's concerning to hear that there's so many that have been in there for over 2 years. But so I'm worried about that. But I'm also point out, just we all know this on the board, but it's just worth saying out loud. That as this jail population grows, the risk of COVID transmission grows as well. So, it's just important work that you're doing, and I appreciate that.
Thank you, Tim, and thank you, Doug. Okay, if nothing further from the board, Aaron, do you want to go to the, or do we want to go to the corrections medicine dashboard?
I think he didn't have his headset on. Yeah.
Yeah, we were discussing a technical difficulty. Sorry about that.
Okay, I think we're ready for the corrections medicine dashboard.
Okay, sounds good.
Good morning, everyone. This is Valerie. As Aaron is pulling that up, what you're seeing today that is published is actually our November data. We do have our December data calculated. We didn't see any trends that were alarming at this point, but what you're seeing from this month is Aaron's effort to convert what we had been producing manually for the medical dashboard. And it looks it's much easier to interpret, I think, in this way. And we certainly have a consistency as we look at these pieces of information across the facility as a whole. So we'll have the December data distributed out to you in this format, but for right now, this morning, this is still looking at November data. So huge effort, though, I will say, not to diminish that at all. It was a huge effort for Aaron to coordinate with the rest of the folks on my team and get this transition over. So if this looks good if it's easy to interpret and provides that level of consistency from the board's perspective, then this is what we would proceed with on a normal basis. So welcome your thoughts on just that concept of aligning this, and we'll go from there.
Valerie, just my comments about Sentinel events. It's much more, they really should be expressed in raw numbers instead of percentages, which appears to minimize it. And raw numbers, since they're essentially things that should never happen, or we hope should never happen, expressing them in raw numbers better than a percentage, and I see the numbers available there. And then my request to let the board know about the detail of Sentinel events, not the names, not the staff involved, not the inmates involved, but the nature of the event itself going forward. And I think that's it. They're working on what the board should know, but I just want to say that again out loud.
Yes,
I second Mary's observation there. So the rare event thing, so hopefully rare event things such as sentinel events and morbidity and mortality review, we should really just make those raw numbers instead of a percentage. Otherwise it gets drowned out because it's a huge denominator. So
yeah, we can have that updated with this new December visual of it. It was just
I'm happy to change that.
Yeah, it was just a complete replication of the existing, what was the existing manual piece. So easy adjustment. Okay. I'll actually pause at this point and ask Dr. Doucette to to speak on the pieces that she has to address as well. And then we can talk about the one metric that I draw, which has had all of our attention for quite some time, is the medical staffing gap. We've got some positive updates to share on that, but they really relate to the broader operational models that we're evolving. So we can address that here shortly. I'll ask Dr. Doucette to jump in if you don't mind.
Awesome. Thank you all. And I'll, as Valerie mentioned, step in for several updates that are, kind of broader at the DPH level. And first, and most importantly, to update this board on a promotion that happened within DPH for our own Valerie Nelson. So Valerie has been promoted and selected for a new role within DPH. That role is called the Director of Clinical Services. And that is a role that is a new position and a role that we have created to support the clinical service delivery broadly across DPH, to include the corrections medicine practice, our community clinics, and all our forward-facing COVID care. So obviously, Valerie's performance and support of the jail and our corrections medicine practice has been phenomenal over the last year and several months that she has been with us. And it probably feels like a lot longer to her. And we are really thrilled to be able to have her join our team in this new way. And she has certainly jumped in the last several weeks as we have quickly scaled our COVID vaccine response in really meaningful ways already. So I did want to announce that officially to this board, give her the many kudos that she is due, and also just to reassure the board, as well as Justice Services, that Valerie will remain heavily engaged in the work of corrections medicine. She has made it very clear, and it's certainly a major priority of DPH, that she feels very passionately about the work in corrections and will continue to be engaged there. So for the time being, Valerie actually will stay positioned at the jail for a while to make sure that that is a stable transition. We will be hiring for her current position, so that role will remain, and we're really excited to have her in that space. So just wanted to make that known and let folks, and so when you see that movement for new hiring, you'll understand what's going on. So I think that's that piece. I did also just want to update broadly about vaccination efforts around COVID-19 as it relates to the jail. So obviously, the Department of Public Health received our first shipments of vaccine for COVID-19 in the last about week and a half to 2 weeks. It's certainly been a busy time for us as we scale very quickly and work to deliver vaccine to the population, and certainly with an equity lens and an eye for support of our patients and staff that are at risk. So you're obviously all certainly aware of the changes in the tiers that came from the state last week, and kind of that broadening of the group of folks who are now eligible for vaccine. So as you're all probably aware, DPH it continues to scale forward-facing events. Did want to make this group aware that we will be offering specific vaccination events for selected county employees this weekend, to include the entire staff of Justice Services as well as the juvenile detention facility. So really hopeful to get more folks protected in that way. The corrections medicine program has already been offered vaccination about a couple of weeks ago as forward-facing healthcare personnel. So again, we continue to follow state guidance on who can become vaccinated, but are excited to offer that special opportunity this weekend. I would open it up a discussion and support and ideas from this board as we kind of enter into this space and talk about uptake of vaccine. We are certainly seeing a lot of the patterns that we're noting that we kind of initially saw at the hospital and healthcare setting level, and as now we're getting into additional tiers. Really look to this board for support and suggestions about how to promote uptake among our staff, and then certainly our patients as well, as we're already seeing that as a potential gap or a place that we have some areas for improvement. So that is something we'd love your support on. Please also know that we are working diligently to find the appropriate mechanisms to start to support our patients in the jail becoming vaccinated very shortly. So at this point, not all incarcerated individuals qualify for vaccine, but certainly those who meet age criteria or chronic disease indicators will indeed be eligible. And we are looking at kind of very specific channels to bring vaccine to that population within the next week or so in order to support the care for our population. And again, we see this as a major piece of how we approach vaccine delivery equitably. So I'll pause and again, welcome feedback, suggestions and ideas from this board about that vaccine delivery piece as it relates to this practice.
Yeah, Jeff.
Yes, go ahead, Tim.
So first of all, congratulations, Valerie. You deserve that mightily. We really appreciate the work that you've done with others, but you've been leading the effort, as I've said many times, what the Justice Service has done on the COVID-19 effort, I think is heroic and deserves national attention, in my opinion. So congratulations. Secondly, on the vaccine rollout, I have some questions about that. I've been perseverating on this probably more than I need to, but I sit on the St. Louis City Board, and with Alex Garza in the room, I sort of hate to get into this because we have a national expert on this, but I'm going to venture a bit into this. As we all been reading, there's this vaccine rollout is a bit of a mess, put it mildly. And I'm sure you've been living this, Emily. But one question I would have, and with due honor to everything you've been doing to try to protect the people in the Justice Center and the healthcare workers and the correctional officers, which has been amazing so far. I think we have to do everything we can to protect those correctional officers, those healthcare workers. So I'm curious about what's the take up on the vaccine, because what I've been hearing around other places, there is some not 100% take up among healthcare workers. And that's troubling to me. And what's your policy about taking up the vaccine? Healthcare workers, for example, should, in my opinion, all take it up. I don't know if we should force them, but there's some incredible amount of misinformation in there about that. We live in this society now where that's the case. And I've been hearing some things which I won't repeat because I don't even want to give peddle that kind of stuff. But and I think we probably should have some trusted messengers around us. I agree with you to try to get that uptake up. So anyways, I just want to hear what the take up rate is, what the policy is, and what we can do to improve that take up rate.
Sure. So I can certainly share the limited information that we have so far on the DPH side, and certainly sit on many meetings with Alex around this topic in the healthcare space as well. So it is certainly true that uptake among all populations and starting with healthcare workers has been a bit lower than we had hoped. I will say that DPH compromises we have about half of our workers in that 1A category who are already offered vaccine, and the other half public health workers will be offered vaccine this weekend. Our uptake rate so far among that initial population that was offered vaccination was about 65 to 70%, which is actually quite high compared to some of the other markers that we are seeing in other industries and with other partners. So that is the data I have to share right now with regard to, again, DPH 1A eligible employees. After this weekend, we will have much more of a sense of what that looks like for public health across the board, and as well among other county employee groups, including Justice Services. Those scheduling links are still open, and we are still seeing folks trickle in. But the initial response to our call for opportunities for vaccination was a bit lower than we had probably initially hoped. So we will, Valerie and I have talked, and certainly we'll be engaging with Doug and team about messaging and support and opportunities to kind of talk through concerns and evidence around this. And certainly, I know myself and several of our physician leaders in DPH have spent a lot of time in any amount of messaging and individual conversations with folks to support uptake. Certainly, DPH also has a pretty broad communication-based strategy that we continue to build that targets all sorts of populations. So don't quite have the data specifically I think you're seeking yet for the jail in particular, but we should be able to have that by next week. I'll defer to Doug and Valerie, or certainly Alex as well, for additions to that.
I'll just add context. So Tim, you're exactly right. There is some hesitancy in taking up the vaccine, and really, I think the health systems and other organizations are just a reflection of the general population. To be honest, a lot of it is dividing along geography, socioeconomic status, education, things like that, and so there's different ways of addressing that through messaging and making sure delivering the message. Certainly, there's a lot of misinformation out there, and healthcare workers believe in. So it's a messaging issue for sure. A couple of things I will highlight as well, Tim. I absolutely think that the St. Louis County Jail should hold itself out to be a best practice for how they've addressed COVID and the prevention of the spread of any COVID in this unit. I think is phenomenal and should be celebrated. And then one last request, which is, hate to see Valerie moving on, but I'm excited for her as well. So if there's any way that some of the board members could be involved in whatever interview process or something for the next Valerie, I think that would be very helpful. Thank you.
Thank you. Thank you, Alex. Valerie, did you have, first, congratulations. And then do you want to respond to that?
I was going to share that even today, we have Dr. Davis, our medical director for corrections medicine, who is going to make some rounds, if you will, through the building and just make sure that she's present and available and that folks know that they can ask specific questions about the vaccine. And we're just trying to open as many channels for information as possible and hopefully drive a lot more folks. Even last night, I was talking to colleagues that had some questions, and it's really, so much of it is a matter of once they're able to talk to someone who has some kind of insider experience or different information to share, then that's offering a lot of reassurance for folks. So we have Dr. Davis kind of making some rounds today to make sure that we can answer some questions.
Thanks, Valerie. And yeah, I would echo what Alex said about, I'm not sure what the timetable is for interviewing the new Valerie. I've been promised by Doug that you're going to train, your successor and stay there for the duration until your successor is trained up. But yeah, I would love to see, people with expertise like Alex have some role in that consultative role in that process if possible. So, okay.
Yeah, I'll certainly take that note and we'll make sure to involve the group. Did also just want to be very clear that Valerie's scope still includes the corrections medicine practice. So she is, it will be involved at a different level, but certainly will remain very engaged in the work. So.
Good.
Jeff, could I add something real quick?
Of course.
I would just like to thank everyone with the Department of Public Health. I got on to register for my vaccine and it took less than 2 minutes, and I'm scheduled for 10:30 tomorrow. Also, Valerie, I think it'd be great to just echo upon what everyone's saying. Would you share what the positive rate was yesterday when we were walking out of the building?
So the testing that we have done to this point has passed 6,500 tests since April. And we have 109 positive patients during all of that time. We have no positive patients at this time. Our last positive identified was on the 8th. And again, everything has been individuals coming through, directly through admission. So just can't be more pleased about that. I think we continue to see a really strong dedication across the facility to the personal protocols that it takes to keep infection low, as we come in and out of the building. So kudos to the entire facility for that. But the positivity rate is quite low. And then the anecdote to that I think Doug is referencing. So we will begin to test 2 different COVID test processes beginning next week. And part of the approach to do that is that we want to make sure that these new technologies are measuring both negatives and positives in the same way as what we know the trusted baseline technology does. And we actually cannot use our patient population here for a valid test of the positive patients because our positivity rate is so very low. So I don't laugh to make that light at all. It is a fantastic thing. So we will have, we feel confident that we'll have a really strong test on the negative patients, but we just simply haven't had enough positive patients to get a valid test out of that. So in that response then, or to respond to that, we actually will then be conducting on-site testing that will be available to staff. So that, again, we've seen quite an uptake, unfortunately, in the last few months from ill staff in the building, but still overall, we've had a pretty low rate. But we're going to open that up to staff, thinking that at least we would have a better chance to test that positive perspective too. So a little bit of irony, but we're going to take it.
Sure. And before we move away from the corrections update, there's been a lot of work on this new staffing model piece, and just want to make sure that gets highlighted at the board level. So Valerie, I'll let you take that, and then we will yield our agenda item.
Yeah, thank you. I don't know how I can forget about this. This has been really, really exciting since early to December. We did onboard the new licenses, the new clinical licenses for the medical team. So we are now working with EMTs and paramedics. We have them focused on 2 specific functional areas in the department. So they are working in the intake assessment area. And then also we have them paired, we have a paramedic paired with a nurse in the infirmary. And we chose those 2 specific functional areas or care delivery paths because of the characteristics that the patients come into the facility with in each of those areas are really, really well matched with the EMT and paramedic training and skills. And we saw an immediate benefit, just with bringing them in, where they're able to really well assess the patients as they're coming into the facility. And then in the infirmary, it's been a really fantastic improvement of skill matching, specifically with the psychiatric patients that we have in the infirmary, because it's just so similar to what the EMS staff experience as they're responding to community calls. So that continues to build. We have onboarded, I think, 25+ colleagues. Not all of them are taking full-time shifts, but they are all taking a commitment of time period. And we can't say we can't say enough positive things about the skills that they've brought to the team already, the attitudes, just digging in. We seem to have some rock stars across those 2 partners. So a lot of just wide open path for improvement with that model.
thank you so much for that, Valerie, and Emily as well, and for everything you guys are both doing. And yeah, it should be a national story. Is it okay if I, publicize a couple of these figures, like the fact that there are 0 positives in the facility at this point? Okay. You said you traced every case to someone coming through admission?
With the exception of the October event that we do know was transmission within the general housing units, every other positive patient has been identified in that quarantine process that occurs for new admissions.
Wow. That's really impressive.
Fingers crossed.
Okay.
Yeah, we've had that one transmission event that did result in 58 patients being, it was, the number I'm looking at is cumulative for that month, but I think that what we tied to the actual transmission was around 52 patients. And the rest of the 109 have been new admissions to the jail identified in the 2-week 2-test quarantine process.
Well, good. Well, again, thank you, Emily, and thank you, Doug, for implementing everything that they're guiding you to do. When I've been on the floors over the last several weeks, I haven't seen staff or inmates with their masks hanging down below their neck or anything like that. Everyone's wearing it over their nose, below their mouth, appropriately. So thanks for the implementation. All right, anything else on that agenda item? Are you guys good? Okay, appreciate it. Let me move on to new business. And actually segue into something I wanted to just mention briefly, which is that I have had a chance over the last several weeks to walk the floors and get to know a lot of folks and just kind of see some of the changes that are being made. I've got to say I've noticed just a huge difference in morale from what I witnessed before the pandemic when I walked the floors previously and visited with folks. And much of this was kind of discovered spontaneously. You get into an elevator with somebody and a staff person tells me that there have been 1,700 video visits, in the last, I think, 4 or 5 months. Someone else, we went into laundry and I just want to share 1 or 2 moving anecdotes from doing this. The woman who works in laundry talked about the fact that, the women inmates there just seemed to adore her, and everybody was just all smiles the whole time. And she said that over Christmas she had gotten them all Christmas goodie bags and brought them in, and she described everything that she had put in the bags and how she had shopped for them, and it was just really neat to see a correctional officer caring that way for the people who did the work, for her at the laundry facility. And she said, "Look, I want them to know how much I appreciate them. There's no way we could keep this place clean and hygienic without them, and they work so hard." And Doug let a few of them know who I think are likely headed home that he would be happy to send a note to the judge testifying to their work ethic and their performance at the facility, and they were really moved by that. You could also tell that there had been exchanges between inmates in different places and the leadership of the jail. When we walk in places and people would say, "Hey, thank you for responding to my question a couple weeks ago. I sent you a kite and I got back a note, in a few days. So thank you for that." So just the responsiveness is pretty apparent. Staff also seemed to be really pleased with the PPE that was available to them. Everybody said, we'd go different places and they'd say, "Hey, thanks for the gloves," or, there was a new ice machine somewhere and someone appreciated that. So a lot of different vignettes that I could share, but the one consistent one was people seem to appreciate the food. So whatever changes have been made at that level seem to be pleasing people. So I just wanted to share that. I don't have any other new business, so unless any of the members of the board have things they want to discuss, I don't have anything else, but I just wanted to yeah, Phil?
No, go ahead, Jeff.
Okay. But I did want to just apprise you all of some of the things I'm hearing and seeing on the floors. I also had a chance to let several people who I think are soon to be departing know about the Second Chance Job Fair work that I'm doing through St. Louis University, and Doug agreed to have every case manager basically institutionalize a policy whereby everybody leaving would get information about connecting with second chance employers who will disregard things that show up in a background check as long as whatever offense shows up is not directly relevant to job performance. And so it'll be great to have a pipeline of people leaving here and then going right into potential job opportunities. So I'm looking forward to that partnership, and thanks, Doug, for your willingness to do that. Anything from anybody? Okay. It's time to hear from visitors. Do we have any visitors who are?
We do not.
We do not. Okay. All right. Well, in that case, I would like to ask the board to consider a vote to meet in closed session pursuant to revised statutes of Missouri, section 610.21, 13513 and 14, and St. Louis County revised ordinance section 114.020.1, 1313 and 14. Do we take a roll call to go into executive session? Okay.
Mr. Smith?
Is there a second to my motion?
Second.
Thank you.
Second was Duval.
Aye.
Okay, Reverend Duval? Reverend Duval?
Yes.
Ms. Taylor?
Yes.
Dr. Garza?
Yes.
Dr. Garza?
Yes.
Okay.
Dr. McBride?
Yes.
Okay, we're good to go. Okay, by a unanimous vote, we will now be meeting in closed session. What do we need to do technologically here?
This is Ray Barnes. So you'll have to close out of this meeting and go to that second link that I sent you, that private link. So just go ahead and end your meeting here. I will keep the meeting live on another PC, and we'll go from there.
Thank you, Ray.
Reverend Duval, it's Ray Barnes. If you can hear me, it seems like you're still on the open session. You'll have to close out of this session and go back to the closed session link I sent you earlier.
Okay, so it doesn't show me closed out of there?
Okay. Now we'll move to the last agenda.
Okay,
item.
Jeff, we're ready.
Okay, thank you, Grant. So moving to the final agenda item, and thank you all for your patience. We'll set this date of the next board meeting for February 26th at 9 a.m. And if there's nothing further, then I would move to adjourn. Is there a second?
Second.
Thank you. Roll call. Roll call.
All right, Mr. Smith?
Aye.
Reverend Duval?
Yes?
Ms. Taylor?
Yes.
Dr. Garza?
Yes.
Gotcha.
All right. By unanimous vote, we are adjourned. Thank you all for everything. Have a great weekend.
Stay healthy, everyone.
You guys too. Appreciate everyone's time. Thank you, Mary.
Thank you.